Ladies and gentlemen, welcome. We so appreciate all of you take time to come to discuss this very important and rapidly changing issue, that of the coronavirus and its impact in Utah, and specifically to our business community. We're grateful for the Salt Lake Chamber for hosting this event and making it possible for all of us to spend time talking about what's happening right now. Just a little bit of background. A couple weeks ago, the President of the United States announced that the Vice President would be handling and overseeing our nation's response to the coronavirus outbreak. The governor, taking the cue from the president, asked me, the lieutenant governor, to lead the response here in the state of Utah. Now, the first thing we did was put together a task force of the best and brightest here in the state of Utah. That task force is being led by myself and Dr. Dunn, who is with us. You'll be hearing from her momentarily. She is the state epidemiologist. We have representation from the Chamber of Commerce. We have representation from our healthcare facilities across the state, of course, from the Department of Health, from the education community, from the faith-based community. Everyone is represented around that table, and we are and will be making recommendations to the governor and other leaders throughout the state, working, of course, very closely with our state health department and our local departments of health. We have 13 of them across the state, and we're grateful for their leadership on this issue as well. It is important, as I always like to point out, that it's the scientists that are making the decisions and the recommendations, not the politicians, but we are leaning very heavily on them and learning from them and working closely together with those decisions and recommendations. We do have 2 cases here in the state, 2 confirmed cases here in the state, and one Friday night, the first positive test that we received, and then we announced this morning another positive test. One in Davis County, one in Weber County, and Dr. Dunn will talk more about those. Just from a higher view, we do know we have now experience with this virus in other countries. Of course, started in China and moved throughout Asia. Italy and Europe now are feeling the brunt of the spread of this virus. It is something we are taking very seriously, and we encourage the citizens of the state of Utah to take very seriously. We hear often this is no different than the flu, that there's nothing to worry about. That's not exactly accurate. What we do know is morbidity rates for this virus are significantly higher than the flu, and especially most impact people who are over the age of 60, and especially those with underlying health conditions, chronic health conditions. And so we're being extremely cautious. What we're hoping to do is prevent the spread of this virus. Now, all of that being said, too, we don't want to induce panic. If people practice appropriate hygiene, if they respond to the recommendations that we have given and will continue to give, life will go on, and we'll be able to weather this storm. We're not encouraging people to panic, make huge disruptions to their life. At this point, we are still a low-risk state, although we do know that as additional testing comes online, it's very likely that we will see additional cases here in the state of Utah. And those recommendations that, again, come from health, from the task force, from our local health departments, it will be important to follow through with those and carry those out. I think it's also important to point out that one of the reasons for the recommendations that we have made and will be making is to really make sure that we don't overwhelm our healthcare facilities here in the state of Utah. When we see high morbidity rates, that happens because the healthcare system gets overwhelmed, and we can't give people the treatment that they need to survive this illness and other illnesses as well. And so when we talk about the potential in the future for social distancing measures, where we spend less time together in large groups, that is specifically designed, one, of course, to prevent the spread, or at least to slow the spread of the virus, so that we can treat people, get them healthy, get them out of the hospitals, and open up beds for other people that desperately need them. And so please pay close attention to the advice that you are given from official sources. The best place for those official sources right now, you can go to coronavirus.utah.gov. That's coronavirus.utah.gov, and also on social media at Utah Coronavirus on Twitter and on Facebook, where we are giving daily updates on the progress of the disease, on decisions that are being made, and information that will be helpful to protect you and your family. We mentioned, of course, the importance of being careful for those that are over the age of 60 and have underlying health conditions. If you care for someone who's over the age of 60 and has an underlying health condition, please be extremely cautious around them. The advice we were given from the CDC yesterday was to act as if you have the disease potentially. So always washing your hands when you see them, making sure you don't cough on them, and of course, if you have any symptoms at all, and we'll talk more about those symptoms, but if you do have any symptoms at all, very similar to the common cold or the flu, please stay home. Please try to avoid contact with other individuals who could potentially get the illness from you, which is again just good practice. Even if it wasn't COVID-19, we should be doing the same. A reminder that it is flu season as well, and the same things that will protect you from the coronavirus will also protect you from the flu and the common cold. And so those are the things that we're encouraging. Now, the last thing I will say, and then turn the time over to Dr. Dunn, is we are encouraging every organization in the state, whatever it is you are in charge of, whether it's your business, whether it's your church or faith-based organization, volunteer organization, or if that organization is just yourself or your family, that you should work on a plan. What would you do if you contracted the disease? What would happen if your employees contracted the disease? And what are some steps that you can take now? Again, we have time to prepare. That's the good news. It's not often when we have, if we have an earthquake, right, or things happen, we're in the moment. Now we can see something coming, and we have an opportunity to be well prepared for that. So what steps would you take if your child had to be home from school? If you lost half of your workforce for a significant amount of time, what would you do? How would you respond? Do you have the ability to do what you're doing now remotely? And if so, can you implement those procedures quickly, or are there things that you need to do to get ready for that? And we know that not everyone can do that. We recognize that, but anything that we can do if the disease comes and if we see community spread, anything we can do to slow that spread, again, will save lives and help other people. So that's kind of a general overview of where we are. Many of the things that are happening in the state. We'll get into more granular details towards the end if we have questions, but I'm happy now to turn the time over to Dr. Angela Dunn. Again, she is the state epidemiologist. She's been incredible. We're working very closely together on all the decisions and everything that is happening on the coronavirus here in Utah. So I'll turn the time over to Dr. Dunn.
Great. Thank you, Lieutenant Governor. It is great to have wonderful leadership here in the state. This is truly an issue that goes beyond just public health. So it's wonderful we have government leaders from across sectors working on this, and then now our private sector. I'm here to give you kind of an overview of what's going on, so you have some background, and we can talk about where do businesses fit into the coronavirus response. So what is COVID-19? So we'll just do a little bit of background to kind of understand where we are and how we got here. Coronaviruses are super common. They cause 1/3 of the common cold. So every year in the winter, people are getting coronavirus infections. What makes COVID-19 specific is that it was a novel strain of the virus that was detected in a human in Wuhan, China, and they were able to sequence the DNA and show that it went back to an animal, likely bats. So it started in animals, was able to then mutate to infect humans, and then was able to mutate again so it could go person to person spread. And these are the things that excite public health, is when you get these novel viruses that we don't have specific treatment for, we don't have vaccines for, and we don't know the course of the disease. So that's why public health gets super excited and starts putting together a lot of resources in order to respond to something like this. We talk about viruses and their incubation period. It's very important for you guys to understand this, because this is the 14-day quarantine and isolation recommendations are based on this. So an incubation period is from the time you've been exposed to the disease, the maximum of time until you actually show symptoms. So for COVID-19, that's between 2 and 14 days. So if you get exposed today and you have no symptoms for 14 days, that means you did not develop the disease and you're clear to go. So a quick overview of what's going on worldwide right now. We have over about 120,000 cases worldwide, several thousand deaths. The important part of this outbreak right now is that the number of cases, the proportion of cases outside of China, the epicenter of the outbreak, is increasing. So it's spreading quickly through Europe, as you can see, and going to North America and other continents. And so those numbers are increasing while the numbers of cases in Wuhan or in mainland China are decreasing. And that's just showing that, we're still kind of on the tip of the iceberg with this epidemic. In the US specifically, we're seeing a lot of our epicenters on the West Coast, and we're now starting to get some clusters on the East Coast as well. We're identifying more and more person-to-person spread in the US. So kind of define our cases in two categories. One is travel, right? Or a known exposure to a contact. So the travel is going to be Italy, Iran, Japan, South Korea, mainland China, or on the famous cruise ships now that are everywhere in the news. Those are travel related. So we worry about those a lot, but the tipping point is going to be when we have widespread community spread where they didn't travel. They actually got the virus in Utah. So they were exposed in Utah, and that's how people got them. Currently, we don't have that. In Utah, we do have 2 cases that were diagnosed here in Utah, but both of them are travel related. So they did not get the virus here in Utah, and public health worked hard to identify everyone who came into contact with those cases. And those people have been notified, and they're monitoring for symptoms as well. So that'll help prevent spread. So the COVID-19 virus is spread by droplets, likely, right? This is a novel virus. There's still a lot of things we don't know, but I get a lot of questions on what are droplets, what does that mean? And it basically means your saliva is getting on someone else. So someone who's sick sneezes or coughs, and it gets into someone's mouth, eyes, or nose, and that person then becomes sick. So that's what we're trying to prevent, is people who are sick spreading their spit to other people. And that determines our response moving forward. So how are we going to stop the spread of COVID-19 throughout the US? 1 are prevention measures. 2, identifying everybody who actually has the disease and making sure those people are isolated so they're not spreading it. Identifying their close contacts and making sure that they're isolated. We call that quarantine, but making sure they're isolated so that if they do become sick, they haven't spread it to anyone either. So I'm going to go through these, and we'll kind of talk about, we'll ask Q&A after, how do businesses fit into each one of those steps? Because this is really going to take a community to stop the spread of COVID-19. It's not just going to be done in public health. It's not just going to be the government, but it's really going to be all of us putting forth these measures in order to make sure that our communities stay safe. So prevention. The way to prevent people year-round from even getting sick with COVID-19, first is going to be frequent cleaning of your high-touch surfaces in your businesses. The virus that causes COVID-19 can likely survive on surfaces for 1 to 2 days. But the good news is that it can be killed by just routine cleaning supplies. So if you don't have to buy anything specific, CDC does have cleaning recommendations on their website specific to COVID-19, but it's nothing more than your routine environmental cleaning. But during a pandemic, we recommend that you do it more often, especially of your high-touch surfaces. Doorknobs, telephones, keyboards, bathrooms especially. Think about increasing those to once or twice a day. We usually do it about once a day for public spaces, but make sure your employees are doing it for their own offices as well, around 2 times a day. And that will really help the prevention of germs going throughout your business. For those of you who have occupational health clinics, it's important to start thinking, how are you going to triage people, employees that come to you that have symptoms compatible with COVID-19, so fever, cough, shortness of breath. If they show up at your occupational health clinic, are those providers prepared to handle a patient with possible COVID-19? Do they have PPE? Do they know how to use it? Do they know how to triage them to the appropriate medical facility to get care if that's what they need? I know some businesses have already told me that they have 2 OC health clinics, and they're deciding to just dedicate one specifically to respiratory virus symptoms, and then the others for like the trauma, right? And so those are kind of the things that businesses can start thinking about in their own practices, is how do you really isolate COVID-19 if you do have an employee with it. Start thinking about technology solutions now. So don't wait until you have a case in your business of COVID-19. Start thinking about how can the workforce be dispersed right now. So Lieutenant Governor mentioned this, if you have the option to telecommute, if you have video conferencing, that's great. If you don't, start thinking about how to get that ramped up so that you don't have to have everybody coming into an office setting every single day. Another option is staggering shifts. So not every job can be done remotely. If that's not the case, maybe there's an option for staggering shifts. So people come in every other day and you have half the workforce. Canceling work-related travel, especially to affected areas, is really important right now. Right now, the biggest risk factor for any Utahn for getting COVID-19 is travel to an affected area. Currently, the highest impacted areas are China, Korea, Iran, and Japan, and Italy, of course. We are recommending all non-essential travel be canceled to these areas. So if you have people that regularly go back and forth, know that upon their return, they're all going to be screened at an airport for symptoms and possibly quarantined for 14 days. And it's just not worth the risk of somebody going abroad to one of these countries and bringing COVID back to Utah. So trying to rearrange your own work travel is really important. So identification. It's really important that we get your help in identifying employees who are at risk for COVID-19. We talked about travel. That's going to be the biggest risk factor. So if you have employees that are returning from a trip to any of those 5 countries, it's really important to understand that if they come to you or they show symptoms of a respiratory virus. Because your risk for COVID is 100% based on your exposure, basically travel at this point, and symptoms, fever, cough, shortness of breath. So the people at most risk for COVID-19 are going to be your travelers and those who came into contact with somebody who's positive. It's spread through droplets. So that's why it's really important to clean surfaces regularly in your businesses to make sure that it's not remaining there and encouraging the spread of the disease. The other piece is our symptoms that we want you to recognize in your employees: fever, shortness of breath, and cough. So what happens if you do have an employee you think has COVID-19? I'll post the hotline, but you can get it at coronavirus.utah.gov. We have a hotline that you can call, and they'll walk you through the process. So the first thing you should do is, if you have an employee recently returned from travel and is showing symptoms of COVID-19, is to isolate them. Either send them home, or they can, if they're in their own office, that's fine too. But sending them home is a great option, and encouraging them to use telehealth or call their clinician. The clinician will triage them to see if they're able to get tested for COVID-19 and take care of their medical needs. So the first thing the clinician will do, they'll put on their own personal protective equipment, assess the patient for respiratory viruses, including the flu. So we'll always want to rule out the flu. And then they'll collect specimens for COVID-19. So that's going to be a nose swab and a throat swab. The people that we are prioritizing for testing are going to be people who are symptomatic and have had an exposure. So once they're tested, currently that test will come to the Utah Public Health Laboratory. There are commercial laboratories that are setting up their ability to be able to test for COVID as well, but it'll come to the Utah Public Health Laboratory, and then within 24 hours, we'll have a result. In the meantime, that employee will be recommended to stay at home on home isolation. So what is isolation? We get asked this a lot. So first, the people that will be isolated. So this is something to think about for your workforce. Or of course, anyone who tests positive for COVID-19, and they'll be isolated until they test negative for the virus twice. So those tests have to be more than 24 hours apart, both negative, and then they're considered clear from COVID-19. The second group is going to be those who public health or clinicians are testing for COVID-19. So if we think someone's at risk for COVID-19 and we're testing them, we ask them to stay isolated until we get the test results back. And then there's that other category of the close contacts to a person or recent travelers from mainland China and Iran right now. If they come back to the US, they're going to be quarantined for 14 days from their last exposure. So those are the 3 groups. When somebody's isolated, that means we're asking them to stay at home, avoid contact with other people. We give them a kind of a care kit of surgical masks so that if they're in the same room as a family member, everybody's wearing a surgical mask. but they won't be able to go to work. They won't be able to go to church. They have to stay inside their home as much as possible. However, luckily, COVID-19 is really mild. So if you have technology solutions for people to be able to work from home, they could be positive for COVID-19 or undergoing testing and still have the ability to work from home. So the biggest thing about isolation is that it's voluntary. There are some instances in public health where we can use our authority to require someone to stay in their home. We're going to try not to do that as much as possible with this. And so we need your help to help patients adhere to home isolation. Think about flexible work policies. We've talked about the ability to telecommute. Evaluate your own leave policies. What happens if someone doesn't have sick leave? We already know from a lot of literature and practices that people don't like using their sick time. They'll come to work if they have like a slight fever and a slight cough. We do not want them to do that right now. They need to stay at home. So we need to make sure that our leave policies are not a barrier in keeping them home. It's also really important to protect the privacy of your employees. So if somebody's out for 2 weeks, they might not want everyone to know that they're out because they were a close contact to COVID-19. So think of ways to kind of minimize that rumor mill within your own offices. And then of course, provide support. So staying home for 14 days, while sometimes it might seem nice right now, it can be mentally taxing. And so people will want kind of to still feel engaged in their workplace and not forgotten. And that's really important to people maintaining isolation as well. The other thing that's important is preparing your own businesses. So we're really focused on health of individuals and populations, but we also really need to focus on the health of businesses and trying to maintain business as usual as long as we can or close to it, so that once COVID-19 is all over, people still have that sense of security that the economy is fine, their job is fine, and we can get back to life as much as we can. So things that you guys should start thinking about for your businesses are, if we start canceling mass gatherings, what does that look like for your business? Does it impact your business? Triggers that would move us to that direction include clusters or a group of cases diagnosed in the same time and place. We might start canceling mass gatherings within that location to stop the spread and break the chain of transmission. We've heard of a lot of absenteeism from Washington State, where they've got a lot of cases. And that's not just for sick employees, but it's also their family members and their kids, right? So the message is out there: stay home if you're sick, stay home if you're sick. But if you're a parent and you've got kids who are sick, they're supposed to be staying home as well. So the absenteeism comes from caregiving burden as well. Also think about, is there potential for supply chain interruptions? You might have already been feeling this already, given the travel restrictions, but that's likely to just increase as we move forward in this outbreak. We're not at the peak of the outbreak right now. We're still going up. So it's going to get worse before it gets better. It's important to prepare for all of these things, right? If you've got 50% absenteeism, should we start cross-training people now? Are there temp agencies to work with now? And again, technology solutions could play a big piece in weathering the storm. There's some day-to-day guidance for businesses just to reinforce. We're going to rely on you to educate your employees to stay home if they're sick. And as bosses and managers and CEOs, it's important that you provide a good example as well. So you yourself staying home if you're sick is a great example to the rest of your employees that they should also do the same. We need to really encourage and normalize. I mean, we've all got hand sanitizer now, right? Hand hygiene is paramount to prevent individuals from getting sick and from us spreading it to those who are most at risk. Routine environmental cleaning, again, twice a day will be great as we move forward through this outbreak, especially in those high-touch areas. We've heard some rumors that providers, employers are requiring a medical note for people to return to work after quarantine or after being sick. And that, again, is just like another barrier that we need to try to remove during a pandemic, or a note to even be at home with symptoms. So we're trying to avoid people who have symptoms, mild symptoms, rushing the emergency rooms and going to their clinics and overwhelming them. So if you're requiring them to have a doctor's note, you're actually contributing to the problem of potentially overwhelming our healthcare systems. So let's try to be a little more flexible during a pandemic in terms of trusting our employees that they're staying home with symptoms that may not require an elevated level of medical attention. And also consider being flexible for employees caring for children or other family members who are potentially sick. Highlighting some planning for your businesses, as we move forward, mass gatherings is one, but if in your jurisdiction or where you practice, a school is closed, what does that mean for your employees? Their kids are now not going to childcare, they're not going to school. That could definitely impact your employees and your business as well and increase the rate of absenteeism. These we've already gone through these, so and for the sake of time, I'll just leave it and you'll have copies of these. In general, good hygiene is going to be the way that this is prevented. So we really need to encourage, Lieutenant Governor touched on all this, but washing your hands frequently, don't touch your eyes, nose, or face. Make sure you're routine cleaning surfaces. If you're sick, stay home.
Can you define routinely a little bit more?
Yeah, so during a pandemic, twice a day for high-touch surfaces is what we're requesting and recommending, and especially in the bathrooms as well. So not only your own office setting, but the public settings as well. And the Capitol made the statement too, quit shaking hands. That's part of our culture, but that is an excellent way to spread germs from one another. So elbow bumps, bowing, tapping feet. There's a lot of ways, if you YouTube it, to figure out how to do it without shaking hands. I'll give you PDFs of this. We have some great signs that you can post if you want about what you can be doing and your employees can be doing in order to prevent COVID spread. So I think in conclusion, you guys are part of the solution. You're definitely needed in order to make sure that we don't spread COVID throughout our community. Increase cleaning, check out your work and leave policies, educate your employees, and then prepare for the health of individuals and your business to make sure that we can weather this epidemic storm. I just want to go through, I've had a lot of misconceptions and questions. I know we're going to have Q&A, but I'll just address a couple of them. This isn't a natural disaster. Our water supply is fine. We always tell people to prepare, and I feel like we always think of earthquakes when we think about preparing. This is different. It's a 14-day isolation at home. So food, medications, something to keep your mind occupied. The virus, it's not that scary for the general population. It is really scary for those over 60 with underlying medical conditions. There's about a 15 to 18% mortality rate in that population. That's huge. For the rest of us, it's about 1.5 to 2%, and that's still huge. That is potentially 20,000 deaths in Utah. But 80% of us will recover just fine, but we don't want to be spreading that to the most vulnerable and cause those deaths. So if you're sick, stay home. And, not everyone needs to be treated. There's actually no treatment for COVID. It's just supported. And so those who need to get tested for clinical care will get the test, but those who have mild to moderate illness can stay home and recover on their own. We're going to do Q&A, so I'll leave those. This is our information hotline. If you guys have any questions, they can answer general questions and even connect for medical evaluation as well, and that's on our website, coronavirus.utah.gov. Cool. Thank you very much.
Thank you, Dr. Dunn. My name is Val Hale, Executive Director of the Governor's Office of Economic Development. I would just like you to know that if you would like a copy of these slides, they're available just in the link below the YouTube description. So you can download those and have those, share those with your employees and others. Dr. Dunn, thank you very much. And Lieutenant Governor Cox, I think the state has really been doing a great job of getting out in front of this, and we appreciate your leadership on it. I also want to thank the organizations that helped put this together, the Department of Health, obviously, the Governor's Office of Economic Development, the World Trade Center, and the Chamber. I'd like to give a shout out especially to Pete Cadella from our team and the marketing and communications team who put all this together, as well as my staff, for making sure this is working. I assume it's working. We have, at least once a week, we have a problem with the technology, so it's great. I just would briefly like to mention to the employers out there, your employees spend so much time at your facilities and your businesses, and I really hope that you'll take to heart what Dr. Dunn has mentioned, that you make every effort to make your workplace safe, both clean, antiseptic as possible, but also to have a very friendly environment if and when some of these incidents happen and your employees become ill and their children or spouses, partners become ill. There are a lot of opportunities for you to make it easier for people who are impacted by this to take the necessary steps. And that's, I think, what we would hope that you would do, because I think we all feel a little bit guilty when we get a cough. We think, oh man, I can plow through this. I can go to work. I'm going to be fine. Well, we don't need that now. And make sure that they understand it's not a big deal if they stay home. So please take to heart what you're hearing here today. And again, I appreciate everyone who's put this together. The key is, as the Lieutenant Governor and others have said, we don't need to panic. We just need to be prepared. We just need to address this and take every precaution we can, and then meet it head on. If in fact someone around us does get it, let's work to try to prevent that from spreading even further. So thank you very much. And now I'll introduce Miles Hansen from the World Trade Center.
Thank you, Val, for that, and thank you, Dr. Dunn, for your expertise and leadership. Lieutenant Governor Cox, to you as well. I'm grateful to the Salt Lake Chamber for the resources that you've put in to making sure that the business community here in the state of Utah is prepared, so that as we're prepared, we can continue to lean in and recognize the fact that we're still open for business as a state. My role today is to talk a little bit about the impact of COVID-19 on global markets. And I apologize. I left my crystal ball in my office, and so I'm not going to help yet with any stock tips as we all watch the markets where we've seen significant volatility. But I would like to talk just very briefly about some of the impact, what we're seeing right now, how businesses are responding, and then next, how the resources that exist so that as a state and as a business community, we can minimize the disruption that's caused by COVID-19. I did not need that, but thank you for keeping that from look at that anticipation about prevent disaster, which is exactly what we're trying to do here today. So let's talk about the impact. What are we seeing right now in terms of global trade? Of course, international travel is in many ways the backbone of international trade. The flow of people and goods and services, whether digital or physical, going around the world, we're seeing significant disruptions there. That is leading to a dampening of economic activity, which reduces demand for goods and services all around the world. And at the same time, we're seeing the rapid increase of uncertainty. And if there's anything that markets hate, it's uncertainty. Capital is a coward, and as soon as you see uncertainty increase, you're going to see capital flee to the sidelines to try to figure out what's happening. And that's what we're seeing in global markets. That's why you see the disruption, not only here in the United States, but in Asia and Europe as well, in volatility in stocks. And that's why we're seeing a significant decrease in shipping and disruptions to supply chains. I just saw some information, got an email from the Port of Los Angeles. This past February, compared to last year, February, the volume of trade going through the Port of Los Angeles is down 23%, and they expect to be even a more significant decrease here in March. And so we are seeing supply chains decrease. And for a lot of us, we think, you know what, I don't have to worry too much about a supply chain. I'm not a small business owner, until you realize that we're all part of a supply chain, whether we're at the company side or whether or not we're the end user as a consumer. And so these disruptions of supply chains, this decrease in travel, increase in uncertainty, is having unquestionably an impact on the global economy. It's creating challenges for companies, and it's something that we all are feeling very acutely. At World Trade Center Utah, we were taking a group of 12 advanced materials companies to a trade show in Paris. That was canceled, and we had phenomenal meetings lined up for these Utah companies to go and connect with global players. And that, unfortunately, it's not going to happen. Postponed until May. We had another group of companies just last week that were going to go to Taiwan for another similar trade show. That also was canceled. So now they're here in Utah rather than connecting with new partners in Taiwan. And we had a group of companies going to the Singapore Air Show. And this was earlier on, a couple companies went, but we saw significantly less attendance from key global players we hope to connect our Utah companies with. And so all these things are making it more difficult for our companies to connect with potential partners, buyers, suppliers, investors internationally. And so what are we doing about it and how our business is responding? What we're seeing is a few different things. One, we are working very hard to help our companies prepare, to help them think through, what market research should they be doing? As this spreads, how can they help ensure that they continue to engage in international trade, even as the outbreaks continue to spread in different parts of the world? A very interesting stat is Brookings did some research that looked at the Great Recession from 2009 to 2011. Companies that did not engage in international trade, did not export, over that period of time saw a decrease in revenue on average of 7%. Companies that were engaging in international trade, even though the recession was global in nature, those companies who were engaging in international trade saw an increase in revenue by 37%. And so you see that even when there's tough economic times, companies are able to find partners and buyers or suppliers or investors internationally are able to identify areas where there's still growth happening and take advantage of that. And so what we're doing is we are taking a case-by-case approach to the various international activities that we're doing. We're doing our homework. We are looking very closely at what's happening with the CDC, what the State Department is saying. We're working with our international partners to understand the situation on the ground of where our companies may be going. And if there's not heightened concern or heightened risk, then we're encouraging companies to move full steam ahead. We're providing grants and doing free market research and free consultations to help companies so they're able to go and take advantage of opportunities. And I just thought about, this week and early next week, we had significant opportunities with a delegation from Saudi Arabia, from Japan, Azerbaijan, and Brazil. So what did we do? We looked at Saudi Arabia. They were primarily US-based, a not significant outbreak in Saudi Arabia, checked with the CDC and the State Department. Our Saudi friends are here in Utah right now. We're having phenomenal meetings for our Utah companies. Azerbaijan was the same story. Brazil, a group of companies coming early next week from Sao Paulo. Again, check the CDC, State Department, talked to them on the phone 2 days ago, and there's no reason to cancel them. So we are encouraging them to come. A large group of companies are coming here to Utah to connect with our Utah companies. Japan, that's one that there would be some concern, right, Dr. Dunn?
Yeah.
So what we've done there is we made sure that the people who are coming were all US-based. None of them had been in Japan recently, and so therefore, no reason to cancel, move full steam ahead. And that's the approach that we're taking is working with partners and our friends, whether domestically or internationally, to look at the opportunity, do an assessment, and then make a prudent decision. And then whether the prudent decision is to move forward, we move forward full steam ahead because of the benefits we talked about before and the importance of international trade all the time, but especially in a time when there's some more challenging circumstances globally. And so finally, very briefly, in terms of what resources exist, I have touched on several of them. If you are a business and you're worried about your supply chain, if you're worried about international travel, you don't know for sure, is it safe or is it not safe? If you wanted to take a trip and say you're going to Japan and you no longer can, reach out to us so we can help make more connections. We can help arrange video conferencing, lean on technology, as we've discussed, so you can continue to have great interactions, even as we continue to see increased challenges and disruption with international travel. And at the end of the day, like the Chamber is encouraging us, we need to prepare and do everything we can, and then make sure that everybody knows that we're still open for business. And as we are prudent about what we're doing, as we're continuing to engage, that I'm confident that Utah, as we are many times, will continue to be an example of what it means to be wise, but at the same time to continue to engage in a way that's unique compared to every state around us. And so again, Lieutenant Governor, Dr. Dunn, thank you so much for your leadership. And for anybody who's out there watching this, please reach out to worldtradecenterutah.com. Shoot us an email, engage. We are here to be a resource for you as you navigate these difficult circumstances. Thank you.
Well, good afternoon. Thank you. It's my honor to be here today to represent the Salt Lake Chamber and to join our partner organizations to discuss this important information that we have today. As Chamber President and CEO Derek Miller mentioned in the Deseret News over the weekend, and as Miles referenced, virus or no virus, Utah remains open for business. Knowing that life must go on, our industry groups, from retail to service to travel, have prepared for conditions like those we face now. They follow strict protocols. Their personnel are well trained, and they have contingency plans to protect themselves and their clients. Last week, the Chamber announced that we have a clearinghouse for information. We have ideas and best practices that businesses can undertake to prepare for coronavirus. These are found on the Chamber's website at slchamber.com. There have been a lot of websites today, so let me give you that again. It's slchamber.com. Among the best practices, and I know we've mentioned some of these today, but I think they're so important, I want to mention them again. There are a few that we should focus on. Creating a risk management team and a contingency plan to prepare your organization. Establishing an emergency operations center for your employees and your clients. How and when to implement an emergency remote work plan. That may be one of the most important things we're focusing on today for businesses. How to respond and adapt to rapidly changing conditions, needs, and threats. And my goodness, this seems to be changing almost every day. And the importance of including employees and clients in each step of the rapidly changing process. Again, you will find all of this information at slchamber.com. It is online now, and it will also evolve as conditions change and needs arise. We invite everyone to use this great website and to stay involved. Communication is critical to our success, as is understanding that what is best for one is best for all in Utah. Together, we must stay up to date and work cooperatively as we have so far to prevent, plan, and practice. And thanks so much for the two of you for all of your leadership so far. Thank you.
Okay, I know we have some questions that have been asked, and I think we'll ask Dr. Dunn. Most of these are pointed towards you and me, I think. So we'll try to answer as many of these as we can while we have time. Maybe I'll just have you come up here with us, and we'll try to get through a few of these. These have been sent remotely to us. A great use of technology. My regards to the Chamber and making that happen. So what is the state of Utah doing to balance patient privacy and transparency? Will health officials release the number of coronavirus positive tests, and how quickly will officials inform the public?
Sure.
This is definitely in your wheelhouse.
Absolutely. So we have a plan in place that within 24 hours of a positive test, we will release that information to the public. It has happened within 5 hours for the past 2 cases. But we do that, so we balance that with the patient privacy, that we only give limited information about the person who is infected. So we're doing it by county and local health jurisdiction. And then other than that, we give an age range, but not much more information because it is scary and uncertain for the individuals who are infected. So we do everything we can to protect their privacy as well.
Okay, thank you. Next question. Some of these have been answered. Some of these were submitted early and they were answered by Dr. Dunn and others as we talked about it. Can a person pass this virus along during the incubation period if they show no symptoms and we are not yet aware of having it?
Sure. Just changing that. So the incubation period we talked about a little bit is 2 to 14 days. So from the time someone was exposed, the maximum time that they would show symptom is 14 days. If they don't have symptoms after 14 days, they don't have the infection. There's a lot we don't know about this virus, and asymptomatic spreading is one of them. If there is the ability to shed or share the virus when you're asymptomatic, it's not very effective or efficient because, again, we're looking for those droplets. And so if you're not coughing or sneezing, you're not going to be really good at spreading it to someone else. So we're really using the symptom onset as the time when someone's infectious.
Okay, so be very careful. Again, that's why we're encouraging people to try to avoid contact if they have any symptoms. And I think it's important, and Dr. Dunn mentioned this, but I want to reiterate that for 80% of those that get the virus, the symptoms will actually be fairly mild. You may not even see a healthcare provider. In fact, we hope that you won't unless it's absolutely necessary, right? We're trying to avoid that. And so for most of us, those symptoms will be very mild, and we'll just go about our life. But we can still spread that with mild symptoms. And to somebody who are in the 15% that will have more serious reaction to the virus, and the 5% who will need to be hospitalized, right? If we have mild symptoms and we spread those symptoms to our 80-year-old grandmother who has diabetes, that could be deadly for her. So again, even though you may just have mild symptoms, it's incredibly important that you don't spread those to those who spread it to those who are at risk. Where can we find and buy hand sanitizer for our businesses? Any ideas on that? This goes to something that Miles mentioned about supply chain disruption, right? There are two parts of the supply chain disruption. One, where maybe factories that produce whatever it is we're trying to buy are not operating, specifically the China connection, where we've seen some of that in electronics and others. And Miles, I don't know if you have any other examples of that happening, but we're hearing it's hard to buy laptops for some of our schools now. And of course, when everybody gets interested in remote work, laptops seem to sell briskly, and if they're not being made at the rate they were before, we have that. Now, obviously, there are some supply chain issues that we're seeing when it comes to PPE. Yeah, and maybe you want to, sorry, we say PPE. I feel like an epidemiologist now. I told her I don't have to be as smart as her, I just have to be smarter than you guys. Just kidding. But personal protective equipment, right? Can you talk a little bit about that?
Absolutely. So PPE, personal protective equipment in the healthcare setting, is what's going to protect the healthcare provider from getting disease. So it's really essential when they have someone that walks into their clinic with symptoms and risks for COVID-19, that they have the PPE available to be able to provide the care that the patient needs, but do it safely so that we don't lose our workforce as well. Unfortunately, a lot of our PPE came from China, and we are seeing shortages because of that nationally. We had 3 major suppliers for our Utah PPE, and 2 of them are no longer able to provide it to us because they were based in mainland China. So we're feeling that in Utah specifically, but nationally as well.
And we're working very closely. The vice president has toured some factories in the United States that are ramping up production of PPE. An important point of encouragement on the masks, the N95 masks that are so important to healthcare workers. Please note, and there was a period of hoarding of masks going on and then selling on eBay for capitalism is alive and well, but the FEMA has taken most of those masks and will be assigning those. A mask is not going to necessarily protect you from getting the disease as an average person. Of course, it's important for healthcare providers. For people who have the disease, we want them wearing masks so that when they sneeze into the mask and not across the room on other people. And so those masks will be distributed to people who have the disease and their family members to try to prevent that from happening. As far as hand sanitizer goes and others, by the way, there was a run on toilet paper. We understand it's important if you do have to be quarantined for 14 days in your home that you have access to that. But the bottled water thing, again, doesn't make as much sense. Great to have if we have an earthquake or something else. The water supply will be fine. So that's not an issue. Hand sanitizer, I would note the best way to kill this virus is actually with old-fashioned soap and water. That actually works even better than the hand sanitizers work. And so if you can't get hand sanitizer, and I know they're updating it, there's more on shelves all the time, but consider the old-fashioned bar of soap and traditional soap to kill the bacteria, make sure people have the opportunity to wash their hands as frequently as possible. Okay, what are the state's criteria, and when would a school, an elementary, a junior high, or high school, be potentially closed, and for what duration? So we've been meeting regularly with the state superintendent, Sid Dixon. We were just with her today. They are in the process of kind of finalizing what that would look like. Again, the good news about having a little time to prepare is that we can get some firm guidelines in place so that we're consistent across schools. What we don't want is, and with all of this, we're trying to be unified because a decision by one group or organization can impact the rest of the state. And this is not like snow days where, if Alpine closes and Provo doesn't, some moms are mad in one district or another. This has life and death consequences potentially. And so we want to make sure that we get that right. Good news is that young people seem to not be affected by this disease at nearly the rate. I don't know if you.
Yeah, so luckily children seem to only have mild disease, which is fantastic. They're not suffering the severe consequences of our older adult population. However, kids are really good spreaders of disease. And so we need to keep that in mind whenever we're talking about school closures, is if we do close a school, where do kids usually go while the parents work? Sometimes to an older adult person's house. And so those discussions and decisions are being vetted at the task force so that we can make that unified approach statewide.
But I think what you'll see once we get this all finalized is where we start to see cases clustering, then you can expect to have closures. The exact numbers and those things we're working through, but I think that's accurate.
Yeah, we're gonna let the evidence and the science guide our decisions. So if we see a lot of cases popping up in a certain area, that's when we'll look in that area and say what closures need to happen.
She referred to the kids as little vectors, and I think that's a great way to refer to them. So again, while they might not get seriously ill, they're really good at transmitting the disease. We've gotten a few questions about potential funding for paid time off for employees. There is nothing at the state level for that. I know there are discussions happening at the federal level potentially. We'll see where those go over time. But I will encourage employers, if you can, and I know every small businesses, I've run a small business before, I know how difficult it is. Most of the time we're just trying to make payroll, and adding benefits can be very difficult to do. What I would say is this: if you can, and I would look very hard at the potential for being more lenient with your time off and with the potential for paid time off. If people have to decide, not knowing whether they have the virus and maybe a cold or a mild version of the virus versus putting food on the table for their families, unfortunately, many of them will make that decision to go to work. And again, we hope that doesn't happen. Please don't encourage you to stay home. But in trying to save a few dollars by not giving paid time off, you may end up inadvertently infecting everyone in your building or in your office, and the repercussions financially could be far worse for that. So I would encourage employers across the state to look very hard and see if they couldn't, for a short amount of time during this epidemic, be able to allow some paid time off, even if it's a lesser amount, whatever it is, to give your employees the incentive to make sure they're not coming to work. Has the state made a recommendation to the Church of Jesus Christ of Latter-day Saints about the upcoming General Conference? What I can tell you about that is we have been meeting with all of our faith-based leaders and having very in-depth discussions. There is a representative for the Church of Jesus Christ of Latter-day Saints on the task force for a couple of reasons. One, of course, they are the largest religion in the state, but also because they are actually the largest purveyor of international travel in the state. They are routinely sending people to other countries and bringing people home from other countries every day. I have a son who's in Tahiti right now, and so we've had in-depth discussions about General Conference. We were told today that they are meeting to discuss the information that we provided to them, and information that they've received from the CDC, and who you will note that they did already decide to not hold their international leadership meetings, where people from other countries, usually during their General Conference the first week in April, travel to have leadership meetings here. They have already canceled those, and they are in discussions on that. So a decision has not been made yet. I would just encourage all of you to stay tuned on that. Dr. Dunn mentioned curtailing traveling. There are areas in the U.S., such as Seattle, that have more cases than Utah. Do you have a recommendation for traveling within the U.S., especially to areas with more cases?
So we always follow the CDC and State Department guidelines for travel. They have the most up-to-date information on all areas at risk. What I can tell you about the Washington and Seattle issue is that it is still, while it is a large group of people with the disease, it is still in one area. So they don't have this widespread community sustained transmission. So it's pocketed into a specific area, and they're doing everything they can to contain it. So right now, just going to Seattle is not a risk factor, or just coming home from Seattle isn't. So we're not recommending any domestic travel restrictions at this point.
Okay. It is a very cheap time to travel. I would just recommend, again, that when it comes to travel, interestingly enough, the filtering of air on airplanes is actually really, really good. And the odds of contracting it because of the air you're breathing or the filtering that happens is fairly low. Now, if you're sitting next to someone who has the illness, of course that changes. But I've seen a lot of empty rows, so you may get an entire row to yourself and not have anyone within 6 feet of you. But what I would say is this: where the disease often gets transmitted on airplanes and other places is, again, from surfaces and touching. And so that's where the sanitation measures that we've mentioned. If you are flying, be very careful about what you're touching, and then again, touching your face. And I know every time we say don't touch your face, every one of us feels like we have to touch our face immediately. So maybe if we stop saying it, we'll do it less, but that is very important for our travelers that are still routinely traveling. Okay. Do you foresee a lockdown of hotspot areas as the virus enters community spread?
Yeah, so we kind of touched on this a little bit. So as we get more cases in Utah, and when we see community transmission, if we start seeing pockets, we will definitely start looking at mass gathering cancellations and making recommendations for events that bring a bunch of people together to not be held. But we're gonna have to wait and see what that looks like in Utah. I think as a prevention measure, what we're doing right now is making sure that those over 60 with underlying conditions are extra cautious and start thinking about how their life might change when we recommend that they also stop attending large events and mass gatherings, because that is the most at-risk population. So that's the current stress right now. If we start seeing pockets of cases, we'll likely have to move toward other mass gathering cancellations.
Okay. I think, do we have a hard stop at 4? Is that right? So
At 5 o'clock. 3 minutes.
3 minutes. I'm sorry, I meant 5. Okay, rapid fire. We've got some quick questions that I think you can answer quickly. I know, because I can even answer these, but they'll trust you more if they come from you. So how long do symptoms typically last once they start? We talked about the 2-week incubation period, but once they start symptoms.
We've seen it for about 5 to 8 days.
Okay. Is there any evidence that the coronavirus will be seasonal like influenza?
We don't know because it's novel, but we are preparing for a second wave come fall of 2020.
Okay, thank you. Has coronavirus come back in the same patient after it has run its course?
So we don't have any evidence of that in the US, and there's kind of sketchy evidence elsewhere that we haven't been able to confirm. So that kind of being immune after you get the disease is still unknown.
Has coronavirus, oh no, I'm sorry, I just said that. Can you test negative during the incubation period but still have the virus?
No, so the test is actually looking for the RNA of the virus in your blood. So if you test negative, it's not in your blood, but we still, even if you test negative in your incubation in the 14 days, we still recommend you stay quarantined for 14 days because you could develop it 3 days later. And so the answer is you don't have it if you test negative, but if you've been exposed, you might if you haven't waited that 14 days yet.
Okay, thank you. Are healthcare providers planning a telehealth program to encourage app-based appointments?
Yes, so we are working with partners right now to ensure that there is statewide access to telehealth and warm line services for clinical triage so people don't have to go into the provider.
And let me just add that they are also ramping up staffing so that they can expand those telehealth services. By the way, if your insurance, if you don't think you have a telehealth provider, you probably do and don't know it. So so now's a good time to check before you get sick, to download the app or contact, again, call, find out, pull out your brochure and find out what your telehealth network is. And please, please, please use telehealth. Let's see. Can you provide suggestions on how we can talk to our children about coronavirus?
My 7-year-old talks about it all the time.
Yeah, my kids talk about it all the time because that's all we're doing right now.
I know.
So yeah, I think some of the messaging that has come out already is really important. First of all, it's a great opportunity to talk to them about personal hygiene and about the importance of washing our hands. I will tell you one great way to talk to them. Go to YouTube and Google sneeze videos, okay? It's disgusting. What you don't realize is when you sneeze how far the velocity that your saliva travels and the importance of sneezing into your elbow. It's a great way to really get their attention on why it's important not to sneeze and why you should cover your mouth. But more importantly, I think it's important to talk to them about how kids are not being impacted severely by this, that their lives aren't at risk. However, again, to be cautious because other people's lives could be. So I would say that. And with that, I think we've used our time and we answered almost all the questions. So good job.
You too.
All right, thanks you guys. I believe that's a wrap. Again, we want to thank all of you who have joined us remotely. Those of you who have joined us here, just to underline this at the end, we live in an awesome state. No one should be more optimistic than the residents of Utah right now. We have a culture of being prepared. We have a culture of working together. We lead the nation in volunteerism. This is what we do best, is weather storms like this. And we're going to weather this one. We would just encourage you again, do everything possible not to overwhelm our medical facilities. If it's not urgent, if you don't have to go, don't. And if it is urgent, make sure you call ahead so that they know you're coming and be prepared for you. And pay attention to trusted sources, not the crazy uncle on Facebook, but the State Health Department, our coronavirus.utah.gov website, and of course the Chamber of Commerce. And again, thanks to the Chamber for hosting us today. Thank you.
Thank you.